we are going to discuss about humerus, particularly its front aspect. So now this is the upper end, this is the lower end, and this is the shaft of the humerus bone. Now this upper end is rounded to form the head, and this lower end is flattened from before backwards and expanded from side to side. Now, how can we determine the side? So, this head is directed medially upwards and backwards. So, and this is the lesser tubercle projects from the front of the upper end. So, and the third for the this determination is the this lower end, as we discussed previously, is expanded from side to side. So now we discuss one by one the head. So this head uh, is about one third of a sphere and is articulates with the glenoid cavity of the scapula to form the shoulder joint. So now this is the anatomical neck. So this separates the head with the rest of the upper end. Now we came to the this epiphyseal line or morphological neck. So it is the junction of convex end of diaphysis with concave end of upper epiphysis. So as in the name epiphysis, so epiphyseal line. Now we came to this tubercle. So this is the greater tubercle and this is the lesser tubercle. This greater tubercle is the projection from the lateral aspect of the upper end, and this is the lesser tubercle projection present on the anterior aspect of the upper end. So now between these tubercles, intertubercle sulcus or bicipital groove is present. So this separates the anterior aspect of the greater tubercle to the lesser tubercle, and these are the lateral lip of the intertubercular sulcus and medial lip of the intertubercular sulcus. So this lateral and medial lip represents the downward prolongations of the greater tubercle and lesser tubercle respectively. Now we came to the shaft. So this is the lateral border, this is the anterior border, and this is the medial border. So now we came to this lateral border. So on the this lateral border, uh, as we know, there are three surfaces. So anterolateral surface and anteromedial surface. So first we will discuss about the lateral border. So the upper part of this lateral border is barely traceable, and the middle part is interrupted by the radial or spiral groove, and the lower part of this lateral border, as we can see, is prominent and form the lateral supracondylar ridge. Now we came to this medial border. So this medial border in its upper part form the medial lip of intertubercular sulcus, in middle part a neutron foramen, and on the lateral lower part the medial supracondylar ridge. And now we came to this anterior border. So this anterior border in its upper part form the lateral lip of the intertubercular sulcus. So as we can see, this is the now uh, in its middle part, it form the anterior margin of the deltoid tuberosity, and its lower part it is smooth. Now we came to this anterolateral surface. So this surface present between the anterior border and the lateral border, and in its middle part a V-shaped deltoid tuberosity is present, and in its upper surface it is covered by the deltoid muscle. So this is, now we came to this anteromedial surface. Now when we came to this anteromedial surface, lies between the anterior and medial border. So its upper one third space is narrow and form the floor of the intertubercular sulcus. Uh, uh, so this is the intertubercular sulcus. As we can see, floor of the intertubercular sulcus. Now in its middle part near the medial border, a nutrient foramen is seen. Behind this is the uh, posterior surface. So now we came to the lower end. So this is the capitulum, a rounded projection. So it articulates with the head of the radius bone. So now we came to this trochlea. It is a pulley shaped surface, articulates with the trochlear notch of the ulna bone. So its medial edge, as we can see in this video, uh, projects down 6 millimeter more than the lateral edge. So this results in formation of the carrying angle. So as we can see in this video, now we came to the fossa above these condyles, these projections. Sorry. So the above this trochlea, on the anterior aspect of the humerus, a coronoid fossa or depression is present, which accommodates the coronoid process of the ulna when the elbow is flexed. Now we came to the other depression that is present above the capitulum. So this is the depression known as radial fossa, present above the capitulum on the anterior aspect of the humerus bone, and it accommodates the head of the radius when the elbow is flexed. Now we came to this uh, epicondyle. So these are the projection from the medial. So it is a prominent bony projection on the medial side of the lower end, and it is subcutaneous. Now this is also a projection from the lateral side of the lower end. So the remaining attachments and the posterior aspect we will discuss in the next part. Thank you.